not going to change. I was watching something the other day with Tucker Carlson was interviewing somebody named Callie Means. I don't know if you saw this, but he's talking about
Ozempic.
Yeah.
Yes, I did see that. Yeah, we were talking about it yesterday.
But one of the big points that he made that people, I think, forget is that why are these drug companies, Big Pharma, spending so much money on advertisements during the news is not to sell their products. They don't have a problem with that. It's to control the messaging.
Yes.
I mean, they're fucking controlling the message. So
For sure.
So if somebody went after that and said, hey, you're not going to be allowed to advertise on TV anymore, because I think we're one of the only countries, maybe there's one other country.
New Zealand's the only other country.
Okay, so there's two countries. It would be, they would be attacked for anti-science or whatever it might be. What RFK wants to do, kind of the dismantling or the reforming, realigning of the CDC and the NIH and some of these alphabet companies who've been lying and misleading the public for so long. He would get absolutely slaughtered by the media. Why? Not because they actually believe that, but because who's paying them?
Yes.
It's those companies. So they control the message. So when you come out and talk about, what you use to heal yourself during COVID, or when I come out and talk about, or Dr. Peter McCullough or Robert Malone, or insert anybody who was just trying to bring Pierre Corey, they get absolutely railroaded and censored and silenced and attacked and slandered.
It's not, it's not the news. It's corporate controlled. It's completely controlled. And it's not good for us. And the fact that people went along with it because they thought ideologically that group of people aligned with their side, and the other side was Donald Trump and the MAGA and the vaccine deniers and all the craziness that they attributed to that. It's really kind of brilliant the way they've pushed this propaganda. But at the end of the day, it's not beneficial to the greater good of society. If the media was legitimate, they would be talking about one of the biggest crises that's happening in this country right now, which is a massive increase in all-cause mortality.
Yeah.
It's a massive increase, and they're completely silent on it. It's like in some age groups, it's a 40+% increase in all-cause mortality, heart attacks, strokes, cancer. Gee, what do you think happened that changed where all of a sudden there's this massive increase and it coincides with something else? Don't you think maybe they would investigate that? Don't you think that you would have some sort of investigative reporter that dives deep into this and gets to the bottom of it? No, they can't because of what you said. They're captured.
They're totally captured, 100%. And it's just on and on and on through this whole thing. My thing is this is, all of us who've been attacked for our position, to all those people, what do you think the fucking motivation is?
Yeah.
Just look at my own situation. Like, I lost friends, allies in the media, millions of dollars in sponsorship because I talked about what worked for me and my own beliefs and my own health reasons why I didn't get vaccinated.
Oh, by the way, you were right.
Yeah.
You were right. Look, you didn't need it. Look how quickly you recovered. You were fine. And
same with you.
Yeah.
And what did they do? They changed the color of your face. they vilified all early treatments, including a medicine that has one of the safest profiles out there. That we've talked about it. The guy who invented it got a Nobel Prize.
Yeah.
They were using it all over the world, in Uttar Pradesh, in Africa, and various places. And that's what you do during the pandemic, right? You find ways to repurpose drugs for early treatments. But now they couldn't do that because if there's an early treatment, then they can't get the UA.
Drugs that have been proven to have antiviral properties.
Yeah. But what's the motivation for Peter McCullough, who got vilified? What's the motivation for Robert Malone?
Well, if you know Peter McCullough is that guy has standards and morals and ethics. He is a rock solid guy.
And he actually treated patients